Welcome all. Welcome to this AimExcellence NFD question answer discussion. And as you are all seeing, we are discussing here in the JQA plus, and it's a JQA mode. So we are just going to give you the answer of this particular question, and then after we'll tell you a little bit thing why we have actually taken up this particular topic. Today I have got news about two cases. One is a person who is a leading doctor himself and a lecturer is actually suffering from AML and needs 30 to 40 lakh rupees for his bone marrow transplantation. And another case I have heard about a case of cholangiocarcinoma, which is a pretty sad thing because surgeon has already given the words, and he is left with few days only. So I have created this particular question. It's a Harrison based question, so question wise is a pretty good one. So important thing is that this particular topic, AML, acute myeloid leukemia, obviously wherever, is a very important topic itself. The question is, after how many induction courses AML patient who failed to attain complete remission is taken for bone marrow transplantation? This is a Harrison based MCQ. The answer is 2. After 2 cycles of therapy, if patient is not getting the complete remission, then he is going to go for the bone marrow transplantation, which is allogenic stem cell transplantation. So AML is actually a cancer which is affecting the blood cells of myeloid line. I'm keeping it very concise today. I'm not in that much mood to speak regarding the AML in detail. What is actually happening? The RBC and platelet levels are decreasing. The WBC level rises, so it is a case of leukocytosis. But despite that, patient will have the propensity of having increased infection. Why it's so? Because it's not normal WBC, and these WBCs are actually not working against the infection. Platelet is decreased, so there will be bruisability, there will be petechiae, there will be bleeding. RBCs are decreased, so there will be fatigue, there will be weaknesses, there will be there will be anemia, pallor. These are the things will be with the patient. So then after we have to start the therapy. We will start with, you remember the mnemonic code, cytarabine, anthracycline based daunorubicin, and we can also add etoposide, which is increasing the chances of fast complete remission. So even after that, if after 2 cycles of therapy, if patient is not getting the complete remission, then we have to go for the bone marrow transplantation. So this is actually the backdrop of setting this particular question. We can also talk about what are the factors like the chemical, like benzenes, the radiation like ionizing radiation, which are actually triggering these carcinogenic changes, the genetics aspect, the Gata 2 angle, We can also talk about the difference in the amount of in the WHO and FAB classification. WHO have 20% and FAB have 30% blast needed for the confirmation of the diagnosis to be a case of acute myeloid leukemia. And we also can talk about the blood site finding of all rods, which is mostly the needle shaped. So these are the important points that we need to remember regarding the MCQ examination. Let's get into the backdrop. I'm not taking the name of the Dr. Physiology. He actually, I've seen the message in the circulating in the WhatsApp. He needs 30 to 40 lakhs for the BMT, and AimExcellence actually have contributed a little. So I have done little calculation. So each MB roughly have, on an average at this point of time, 600 students. There are around 6 to 7 batches which are running. Not all, but maybe a few less, but there are around 4 lakh to 5 lakh doctors. So if all of them even contribute rupees 10, that is coming up 50 lakhs. That is good enough. If 10% contributes rupees 100, and rupees 100 is not a big amount in today's world, that money of 30 to 40 lakh can easily be raised. The whole purpose of showing this calculation that we can do, if we are united, we can raise the money. We actually show the solidarity to the society. Not only we are aware, if anybody of us are diseased or being in a difficult time, we will fight in between. We can pinpoint this is right, this is wrong. That is we'll do, because that is very, very important to do, to continue to excel, continue to become better and best. But important is that solidarity should be there. And if we are united, we actually can heal, we actually can make change. And I hope the young bloods should come together from their individual colleges, and all the professors, the authors, they are also, I'm sure they are contributing their own way. So hopefully this money is going to be raised, and he's going to be get well very, very soon and come back again with a bang with his lectures. Thank you. AimExcellence already did a little, and really wish Dr. Manna to get well soon. Thank you very much.